Hi, my name is Dr. Christy Miller, and I'm a physician at Dedicated to Women OBGYN. Congratulations! We're so excited to support you and your family during this exciting time. Dedicated to Women OBGYN sees patients in Middletown, Dover, Milford, and Rehoboth. However, we only see patients in a hospital setting at Bayhealth Kent campus in Dover. If you are over 20 weeks in your pregnancy and you're having any medical problems, or if you think you're in labor, you'll come to the 5th floor of the hospital. You'll take the elevators that are labeled C2, which are yellow, they're kind of near the cafe, and you'll take the elevator to the 5th floor. When you come off the elevator, you'll come to register here at the nurses station. The nurses will take your information and get your insurance information and register you, and then you'll have a seat in the waiting area. The nurse that's going to be taking care of you will come out and introduce herself, and then she'll bring you into the OB emergency department, or the OB-ED. She'll bring you in by yourself. If you have a support person with you, they'll wait in the waiting area so that the nurse can get your care started, and she can also ask you a few personal safety questions. The evaluation in the OB-ED may take 45 minutes to several hours based on the medical issues involved. If you're in labor, you'll be brought to a room on labor and delivery. All rooms have a convertible couch for your support person to stay with you overnight. There is also a private bathroom with a shower. We also have beds that convert in a couple of ways. For example, this comes out here so that you can rest your foot or you can rest your calf, among some other things that the bed can do to help during your labor. We also have mirrors available while you're pushing. Sometimes women find that it's helpful to learn how you're pushing well by seeing the effects on the mirror, and many women prefer to push that way. When you're in labor, there are multiple things that we can help you with in terms of managing the pain of labor. The first thing is we really want you to be moving so that the baby can figure out how to make its way through the pelvis, and that is a very important part of a vaginal delivery. We have other tools as well. We have a birthing ball, which is a rounded ball that you can sit on to help open up the pelvis. And we also have balls called peanut balls, which the nurse will help you position between your knees so that it keeps the pelvis open for the natural labor process. We also have medications to help in labor. These are intravenous medications that are opioid medicines to help you cope with the pain. And then we also have the availability of an epidural. We have anesthesiologists here 24/7 in the hospital. It is important to know that after hours, that anesthesiologist has multiple responsibilities. So we usually are requesting a within 1 hour response time for a consultation to see if you're a candidate for an epidural. The hospital is in charge of scheduling labor inductions and cesareans. The hospital is responsible for a lot of different patients, and sometimes they have to change your plans based on those responsibilities. Labor inductions can take up to 3 days in time. Sometimes it's only 12 hours, but it really depends on how your body responds to the process. When you arrive to the labor and delivery room, the midwife or physician is going to evaluate your cervix, and then they'll make some recommendations on the process depending on how your cervix feels. So when you're in labor, your baby's heart rate and the contractions are always being monitored, and they can be seen in multiple different locations in the hospital by the nursing staff and the physician staff and the midwives. So for example, up here, the nurses can be working, but they're always monitoring how your baby is doing. If you're having a scheduled C-section, you'll be asked to arrive 2 hours before your surgery. If a patient arrives late or other instructions have not been followed, their surgery may need to be rescheduled or delayed. During your C-section, your support person is allowed to be with you once the patient is completely ready for the surgery. The support person may take photographs. They're not allowed to take videos, but they are allowed to take photographs. The C-section will take approximately 1 hour after the surgery begins, And then afterwards, you'll come to the recovery room where you will be for approximately 2 hours before you move to the 6th floor, which is the women and infants section of the hospital. After the baby's born, we do want to get the baby directly to your skin in something that's called skin to skin. And we have found that that helps the baby regulate body temperature and learning how to breathe or transition from being inside the uterus. After you've had some bonding time with the baby is often brought over here where the nursing staff or the NICU team can evaluate the baby. Sometimes we'll have the NICU team present in the room at the time of the delivery so that they can be here as a precaution. Bayhealth is a baby-friendly hospital. That means they have a specific designation to help moms learn how to breastfeed and the babies learn how to breastfeed. We also have a lactation consultant that comes in every day if you are breastfeeding. Before you're discharged from the hospital, we really would like to have a birth control plan for you. There are some things that are available that we can do in the hospital before you're discharged. For example, we can put in an IUD during the birth, even if it's a C-section, or after the delivery, we can put in an Nexplanon contraceptive device. When you're discharged from the hospital, the midwife or physician will be by to see you, usually after around 3 in the afternoon. Any medications will be sent electronically to your pharmacy, so please be sure that the electronic medical record indicates the correct pharmacy. We're going to want to see you at Dedicated to Women approximately 2 to 3 weeks after the birth. It will depend a little bit on what your medical issues are. We will also want to see you approximately 6 weeks after the delivery as well. If you're having signs of postpartum depression or anxiety, please know that we do have a counseling team available for you at Dedicated to Women.